Good morning, good afternoon, and good evening. It's my pleasure to introduce the speakers from the WHO Western Pacific region for this important topic that we are planning to discuss today. The first speaker will be Dr. Kidong Park. He is the Director of Data Strategy and Innovation at WHO Western Pacific region. He assumed office on May 2022. And Dr. Park has extensive experience in global health policy and management, strategic planning and evaluation. His international career in public health spans from high-level representative roles to technical work on communicable disease control and health system strengthening. Welcome, Dr. Kidong Park. And our next speaker will be Mr. Dilip Hensman. He assumed the office of the role of the Coordinator, Health Information and Intelligence of the Data Strategy and Innovation at WHO Western Pacific Regional Office in Manila in March 2023. Dilip has extensive experience in strengthening health information systems, civil registration and vital statistics, CRVS, and digital health. His career in health information strengthening includes over 20 years of experience in working across different countries. And I would like to add that I had the pleasure of working with Dilip for the convergence missions in Lao PDR. And the third speaker will be Dr. Duan Mengjuan. She joined WHO in 2018 as a technical officer in health information system, digital health, and CRVS strengthening areas. Before joining WHO, she worked in China's Center for Disease Control, CDC, as a medical officer responsible for China's routine immunization surveillance and vaccine management, using digital solutions to improve immunization service delivery and related national policy and guideline development. And I remember Dr. Duan also shared, when this work was still ongoing last year during the AeHIN GM in Manila, she shared the initial work. So happy to know with less than a year since then that we are going to have the full-fledged competency framework being presented to our members. And thanks once again, and welcome, Dr. Park. Over to you. Thank you.
Thanks, Jai, and then thanks, AeHIN, for inviting us to introduce our newly released Data Management Competency Framework, which was published in May 2023. As introduced earlier, I'm Dr. Kidong Park, the Director of the Data Strategy and Innovation Group at the WHO Regional Office for the Western Pacific. I'm pleased to share tonight with you how to use the framework to measure competency gaps and then guide the development of the competencies across the whole data lifecycle. I hope it will benefit your routine work and support systematic capacity building in your countries or organizations. We will cover 4 areas today. First, we'd like to introduce the structure of the WHO Western Pacific Regional Office and my division to understand better how we support our member state in the region. Then we will walk you through the framework and then show how it can be used in the field through Papua New Guinea's implementation story. At the end, we'd love to hear from you all the questions and comments. As you may be familiar, WHO member states are grouped into 6 regions, with 1 regional office in each region. We, Western Pacific region, work with health authorities and other partners in 37 countries and then areas, with over 1.9 billion population, which is more than 1/4 of the world's population. Our region is quite diverse and the reaches extend the Mongolian steppes in Central Asia, east to the Pitcairn Islands in the Pacific Ocean, and south to New Zealand. The Data Strategy and Innovation, DSI Group, was established in 2019 so that the WHO and member states can use the operational shifts to deliver the thematic priorities of the For the Future vision that will support member states to create a healthy future. We have 4 units, cover 4 technical areas. For the Health Information and Intelligence Unit, HII, where Dilip and then Duan are based, They are mainly responsible for health information system strengthening, digital health, and then civil registration vital statistics, CRVS system strengthening. Decision makers and the broader populations have recognized the importance of the resilient and robust health information system with a trend of the increased investment over the past 2 years. Multiple digital tools and then platforms have been developed and or embedded into current systems in member states. However, a common challenge is that health information workforces do not have the robust capacities to match the rapid development health information system and emerging data needs. The development of the health information workforce capacity is lagging behind the continuous improvement of health information system, and there are large variance in the roles, responsibilities, and the competencies across the health information workforce, both within and between countries. Capacity building initiatives and then activities normally follow traditional, fragmented, and ad hoc approaches as shown on the left of the slide, which regularly result in suboptimal and non-sustainable investment returns. We, WHO Western Pacific Region Office, has been actively leading the design and development of a systematic and integrated approach, which is the sustainable capacity building to strengthen the health information workforce capacity for better data use through an improvement of the decision-making and health services and health outcomes. The approach could dynamically connect health information workforce competency with organizational and institutional structure, request continuous organizational and individual performance evaluation and measurements to benefit human resource management and development, and promote strategic cross-institutional collaboration to maximize capacity building synergies. The outcome of these efforts, in collaboration with a mixed team of the WHO colleagues from headquarters in Geneva and then country offices, external partners and experts, is this data competency frame. It is an essential tool for health information management team in the member states to identify capacity gaps and then plan and drive the competency developments of their health information workforce across different levels of their health institutions and organizations. This tool can help to measure the skills and the knowledge gaps of the individuals or homogeneous role types within the health information workforce at each step of the data life cycle. Identify and specify the required skills and knowledges within the workforce to match current roles and the responsibilities. Identify and map the priority areas for both short and the long-term training and development planning at the individual, unit, department, and the division level within the health information workforce in the organization, and inform, guide, and support strategic human resource management activities such as recruitment, selection, and appointments. Also team formation and composition based on the mix and the balance of the available competencies. This development journey started in 2021 through situation and needs analysis on what is urgently needed, and has been a long-term bottleneck for health information workforce capacity building in member states. A common request is no clear instruction and definition on required data competency for data persons. Hence, the team decided to start from this aspect and drafts a competency gap assessment to pilot in 1 or 2 priority countries, which as listed here, we started from Laos People's Democratic Republic in the middle of the 2021. Then a core working group was established across the 3 levels of WHO Secretariat, and the initial draft was developed by the middle of 2022. An external expert panel review was conducted, and the framework was ready by end of 2022. Finally, it was published in May 2023. Now, I will hand over to Dilip to get you a more detailed introduction on the structure and content of the framework. I'll stop here, back to Jay, and then hand over to Dilip.
Thank you very much. Thank you very much. So if I may take you through the structure and then the content of the framework. Let's start with the target audience. It covers a very broad spectrum of a target audience from health workers who develop and manage and use health information systems to health workers who input data and extract data for routine work on a daily basis, and of course the decision makers and influencers is the other key group that this framework is targeted towards. Just to take you through the structure of this framework, first of all, it includes 4 key competency areas that you would typically see as part of any health information workforce. You'd have people who generate data, you'd have people who process data, you'd have people who analyze data, and you'd have people who use data. So these are the 4 competency areas that is part of this framework: data generation, data processing, data analysis, and data usage. Now, as you could imagine, a framework of this nature is multidimensional. So across these 4 competency areas, each of these competency area has 4 to 5 competency domains. For instance, the data generation function would include data management and planning, data creation, data collection, and data maintenance. So likewise, across these 4 competency areas, there are in total 17 competency domains. And in each of these domains, there is an expected set of knowledge, skills, and attitudes, which are clearly listed in this framework. And this is across 4 proficiency levels, starting from learner beginner to a novice practitioner, to an independent practitioner, and a master practitioner. So it builds on from the knowledge and skills of each level, from a beginner to the master practitioner level. So let me take you through some of the contents of this framework. As I had mentioned before, there are 17 domains across the 4 competency areas, and these are the 17 domains that are listed under each of the competency areas. So under data generation, you have data management and planning, data creation, data collection, and data maintenance. Likewise, under data processing, you get data entry, data cleaning, data validation, data verification, data transformation. Now, for each of these competency domains, the framework goes on to describe what is expected, what competences are expected across the 4 different proficiency levels. Right, let's take an example here. So like I said, there are 4 competency areas. Let's take one of them, data processing. And under data processing, there are 5 domains. That's data entry, data cleaning, data validation, data verification, and data transformation. And for the ease of use, each of these domains have been clearly defined so that there is no ambiguity between what the domains mean. So there is a clear definition that's provided as part of this framework. And then let's go into detail and look at one of these domains. Let's look at data validation, for instance. Under data validation, there is a set of a set of some knowledge that's required, and then a set of skills that are required. And these are listed against each proficiency level. So starting from learner beginner. So for instance, what knowledge is required in data validation for a learner beginner? That's listed there. You'd see what data validation is and its role and importance in the data entry process. This is a basic knowledge that is required for a learner beginner. But as you move on to a novice practitioner, an independent practitioner, or a master practitioner, it builds on, and more knowledge and skills are expected across. And that's what is listed in this framework. So let's look at another competency area. Let's look at data usage. And in the area of data usage, there are 4 domains. So one is as a data user, a person is expected to interpret data and find conclusions. Data integration, data presentation and reporting, transfer to action-oriented recommendations. These are the typical roles of someone who should be using data. And across these 4, so each of these domains are clearly defined, as I mentioned before. And for each of these domains, a set of knowledge and skills are then listed across the 4 proficiency levels, as you'd see in the next slide. So here you would see, so let's look at data interpretation and conclusion. So what a learner beginner should know and what skills should that person possess? Or if the person is an independent practitioner, what knowledge should that person have and what skills should that person possess is clearly listed as part of this framework. So likewise, if we move to the next 2 slides, likewise across the different areas, across the different domains in data usage, these are listed, for instance, data integration. In the case of data integration, what a learner beginner should know and what skills should the person have. Likewise, what a master practitioner should know and what skills should this person have is clearly listed. Now, when it comes to assessing, then this gives you a very clear guideline. So if you want to know across your health information workforce whether a data integration person has these skills, has these knowledge, you can easily assess it against this criteria that has been clearly listed out here as part of this framework. So likewise, data presentation and reporting. As you know, I mean, this goes on further. It just does not stop at data analysis. So this is something unique about this framework. It goes further and also delves into data presentation and reporting, which I'm sure we all would agree that it's also an important component within our health information workforce. And the knowledge and the skills that a person who presents data and who reports on data should have been clearly listed likewise. Similarly, this is transfer to action and recommendations. So this goes on even further and talks about someone who is going to use the data to transfer that data to action and recommendation, what kind of skills and what kind of knowledge that person should have, and based on the 4 proficiency levels. So as part of the competency dimensions, I had mentioned knowledge and skills, but there's also another dimension that has been added here, which is the attitude. So what the team that compiled this felt was that knowledge and skills alone were not enough to have the job done, and attitude was also equally important. And so the attitude of the different proficiency levels have been listed as the 4 C's. The person should have curiosity, commitment, collaboration, and compliance. And what demonstrable behaviors should each of these domains include has been clearly listed in this framework as well. So So I hope I gave you a good sense of how the framework has been structured and how the content really fits into this multidimensional kind of framework. So at this point, I would hand it over to Dr. Duan, who would take you through how this framework could be applied in a real life setting. So over to Dr. Duan. Thank you.
Right. Actually, in our framework, we have the last chapter to demonstrate how to implement this framework in the field. Looks like very complicated, but actually, if you see the steps, it's quite straightforward. So first of all, we would recommend for the organization or the country, you would map your health information architecture based on your institutional or organizational structure and individual roles. After you finish this health information mapping, then identify and map the roles and the jobs based on the current job responsibility or terms of reference. Then to determine what's the required competency for your data group work. And for the data competency, you can create your data competency profile for homogeneous group of individuals. What's the required skills and knowledge level based on the structure, which Dilip just introduced. Then after you define your required level, now let's based on the required level to map what's the current capacity gap through individual employee competency assessment. Then based on the assessment results, you are able to have a very clear list. What's the gaps for each of the domain in each of the steps for the data lifecycle? Then let's sit down and bring all together through cross-divisional collaboration. So normally, why we recommend the cross-divisional collaboration is never forget to involve your HR department and also sit down together with the departments sharing the similar roles or responsibility on using data. Then to determine together what's the competency development priorities, and then to identify all the existing resources, then mobilize. Based on all these first 6 steps, now you are able to develop a longer term or short term capacity building plan. So for short term, it can be immediate, maybe in next 3 or 4 months, what's the training needs, what's the training plan. But for longer term, it will be also focus on the longer term staff development. So I'm going to introduce how it's implemented in PNG, one of our member states in Pacific in 2022. So here is actually an example which showed also in our framework in Annex 3 to show what do we mean for health information architecture. So basically you can see 3 colors here, dark blue, light blue, and the middle level of blue. So this is used to clarify the levels of health data engagement. Basically, how frequently you are using data or how important the data utilization in your own units, either at department level, unit level, or individual level. So based on this mapping, you are able to identify the homogeneous group, either at department level or individual level. Then we would consider this group of people or this group of departments potentially will have similar requirements on roles and responsibilities. So here is what we mapped for PNG. So because PNG is actually a quite big country comparing with other Pacific Island countries, that's why we are not so ambitious to cover everything. So at the beginning stage, we're only trying to targeting 2 divisions with around 7 units at national level, and then 1 division at provincial level, actually each of the 22 provinces with also 6 to 7 units. Then based on this mapping results, we are able to identify 3 types of data person who are sharing very similar roles and responsibility. So group 1 is the national surveillance and evaluation focal points in those 7 units under 2 divisions. And the group 2, we called provincial health information officers, who who are also sharing similar roles among all the 22 provinces in PNG, actually is expected to have very similar responsibility as well, even though the provincial level, they have different development stage. Then we also have group 3, which is the medical record officers, who are also based on provincial level in each of the provinces. So the difference between health information officer and a medical records officer are, one of them are focused on public health data. The other one focuses on hospital-based data or information. Next slide, please. So here is the example for one of the group, the provincial health information officers. What's the initial finding based on step 2? Evaluate their current roles and responsibilities. So actually, we were not surprised to figure out, besides of the main or predominated role on data, actually several of them also undertake non-data roles, and even quite heavy. Then, which is showed on the above table in this slide. So you may notice that some of them also need to conduct the research related work or even service delivery related work. And it's quite diverse among provinces. And on the other hand, for the data, the dominant role of those group of people, their roles are quite diverse as well. And unfortunately, we are seeing because they are at provincial level, we're expecting they are capable to cover majority of the domains for the whole data life cycle. But if you see from the finding in the table below, only 6 domains are actually happening or conducted in their routine work. Majority of the domain, especially on data analyzing and using data for decision making, is completely missing. And none of them touch this area. And even worse, for the area which they are routinely do, which as mentioned, mainly focus on data generation and processing, most of them are at junior level, either learning beginner level or novice level. Rarely has any of them can reach to independent level or even advanced level. So actually, this is the first time we're capable to really measure the data gap in the reality. So when we show the results to Ministry of Health in PNG, they're really happy to see. We keep hearing we have gaps on data using data analyzing, but we never know what exactly the gaps. So this is the first time to show the gap in the systematic way. Next slide, please. So after the initial funding was ready, then the national consultation was conducted in PNG by involving all the key decision makers, implementers, and managers from both national level and provincial level. As we mentioned at the beginning, it's too ambitious to cover everything. So PNG decided to touch the district level and the health center level in 2024. So for 2022, mainly covering national level, provincial level. And if you noticed here, PNG already drafted their data management competency profiles for those 3 groups of data people, which we mentioned earlier. Here is the example for provincial health information officer. And you may also notice that actually PNG requested their health information officer should have stronger role in each of the domain. And also majority of the level should be at least in novice practitioner and even independent level. And they are not too ambitious to achieve master level at all because they want to reach to the target step by step, and which can be more practical in the next 1 to 2 years. Next slide, please. Here is another example for the second group of data person, which is the medical records officer, who are mainly responsible for hospital. Now you may see the profile are quite different from health information officer. For this group of people, they are mainly requested to have main roles for 13 of the domain. 4 of the domains maybe no need to touch, at least in the first 4 to 5 years. And also similarly, they hope most of the professional level can reach at least a novice practitioner or independent level. And on the table show on your left hand is to show how the final professional level was adjusted based on national consultation. So the circles refers to the initial finding, what's the existing competency level, and also potentially the recommended competency level based on the finding. But based on national conversation and the national consultation, all the decision makers, even the implementers, agreed we should set up some targets rather than satisfy what we are doing now. So you can see the big move from the initial level to the required level. Next slide, please. So hopefully the PNG story is capable to give you an overall impression how this framework can be further impacted or benefits your routine life or routine work, as Dr. Kidong mentioned at very earlier. So based on this kind of exercise or practice, ideally, we should be able to dynamic connect the health information workforce capacity building with the organization missions, as well as the organization structure. So no matter you are doing at national level or organization level, or targeting the whole country or only covering your own institution, it should be linked with your national or institutional mission, rather than a silently or independently sit in a corner. Then, as you also noticed, it's the first time can make sure the data gap or capacity gap can be measured and showed in systematic way. And then this will promote very good collaboration across division. So actually in PNG, because of these findings, HR department was much active than before to involve all the country consultation, different one-to-one communication. And then PNG now is capable to call for all the donors to mobilize all the resources from different donors to match to their gap and match to the potential coming training plan. And of course, hopefully, after the training plan was finished, the sustainable capacity building plan will be also developed by end of this year to achieve or at least maintain the sustainable, not only for now, but also next 5 to 4 years. Of course, it's potentially will also contribute to HR departments for further HR recruitment selection. As we mentioned earlier, the profile or the terms of reference or the job description are quite diverse, even though ideally each of the province should have similar role. But with this kind of approach and practice, now HR units capable to have evidence-based solution, how to revise the terms of reference or job description in a better way. So that's all from our side. Maybe let me turn back to Jai. Over to you.
Thank you, Dr. Duan. I think we have some questions and then coming up in the chat and then also in the Q&A box. So Cha, can we take the questions now?
Yes, Sir Jai. In the Q&A box, someone is asking how to measure the personal capacity and knowledge, and how to build personal capacity to work on with data. And they're also asking if there are training courses, certification courses available for free.
So basically for the measurements, we have a list of questions to try to map the true skills and knowledge, which are quite in line with the domains, which Dilip as already showed earlier. And currently, we don't have a standardized training schedule or plan. The reason is different country, the required skill and knowledge level would be different, such as PNG. They don't want to be too ambitious. That's why most of their required skill knowledge is in independent level. But we are also doing pilot in China. For some provinces in China, they would prefer a master level. But I think that's a very good question for us to consider in next step. How can we prepare some standardized training package to support the implementation? And for PNG, based on the gap analyzing, we are now prepare a complete list of training plan based on the required level and the current competency gap, then to identify different topics to each of the domain. So I hope that's answered your question. Whether Dilip or Dr. Kido wish to add more, over.
And just to further elaborate, I mean, there's some exciting work ahead. We are going on to develop an electronic tablet-based assessment tool, a standard assessment tool, which would ask some standard questions, whether the person is able to, for instance, if the person is a data entry operator, whether the person is confident enough to open the data entry screen, enter data, know when there are outliers, and know what to do when there are outliers in the data, etc. So it would ask a standard set of questions, and based on that, it would give a scoring on the proficiency level of that data entry person using these competency domains and using this framework. So we are going on to develop this particular tool, and hopefully we'll have something which can be implemented in a real practical setting with ease. Hopefully sometime next year we will have this tool ready, and it would be made available for use. Thank you.
I'm Dr. Ian. I'm from Jakarta, Indonesia. I wonder for this type of program could provide dashboard in a sense that it's easier to put plan health program in the future rather than a stock of numbers. So how do we leverage this? Thank you.
If I understood you right, I mean, this tool can easily, the assessment itself could easily be turned into a dashboard. So once you do the assessment, you could set the proficiency level that you would expect in a certain setting, then conduct the assessment, and then work out the gap. And this can easily be turned into a dashboard so that it shows you at which level each of your personnel are across the different competency domains. And I think for PNG, that's exactly what was done, a very graphical or a visual representation of that data, the competency gap. And as part of this electronic tool that we are developing, this is also built in. So once you do the assessment, once the assessor sets the proficiency level and does the assessment, then the gap would appear as a dashboard. So for instance, let's say it was a data processing role set at learner beginner, and then whether the person across the 5 competency domains for data processing, whether the person had the required skills and knowledge and what the gaps were. I mean, that could easily be visually shown on a dashboard. I hope I answered your question.
I can see another question from Dr. Chermoni. He's from Cambodia, MH Cambodia. But Dr. Moni, can you explain your question a little more?
So I gather it's asking about the dynamic nature of these assessments because it changes over time. And that's exactly what it's supposed to do. I mean, a person's capacity gap would be assessed today, and then there would be a tailored capacity building plan. And following the training programs that are offered to these personnel, then there would have to be repeat assessments to see if the competency levels have improved over time. And certainly that's what this framework would support in doing as well. It's not just a static one. I mean, based on the assessment, the gaps would be identified. You address those gaps through a systematic training approach, and then you repeat the assessments to see change over time. If that was what the question was trying to ask.
Thanks, Dilip. That was helpful. I just have maybe if there are no other questions, I have just a couple of questions. I heard that of course, like you shared about the PNG example and then the ongoing work in China, if I am correct. Is it still ongoing? And then like, do you have any other countries in the pipeline? That is one thing. And then is there anything planned for this framework as a sequel? Like what next? So you have done this, and then like, is there anything that is coming in the pipeline? So because it may be good for AeHIN members in this webinar to know, and then if there is an opportunity for them to actually contribute. Thank you.
Yeah, thank you, Jai. Yes, we actually received several requests from not only countries, but also different partners on customize the regional, the WHO framework to their technical area, such as we do receive the request from Tonga as well as Solomon Island in middle of this year. And meanwhile, we do receive some partner like civil registration, virtual statistics, sorry, not civil registration, virtual statistics, and the UN8 to potentially develop a customized version. And also we do receive the request from our own technical officers from different technical area in the WPRO, such as emergency team, to develop a similar one. So I think it's really based on what's the request from the individual level. Do you want to have a customized version on specific technical area, or you wish to map all the data person in the country or in your institution? For the next step plan, Dilip already mentioned, yes, we are trying to develop the online assessment tool, which will simplify the interview procedure, which we spent nearly 2 to 3 months to interview all the 22 provinces, which actually around 46 people or individuals. I can't remember the correct numbers, but hopefully next time we are able to invite our PNG country office colleague as well as the PNG Department Ministry of Health to show more details in next step, because the ongoing training planning as sustainable capacity building plan is still under development or under discussion. Over.
There's a new question in the chat box, Sir Jai. It's from Dr. Aminul Islam. He's asking, does WHO have data quality assessment checklist available?
Yes, certainly. I mean, certainly this is slightly out of this focus area of competency assessments and the framework itself. But certainly to answer this question, WHO does have a very good data quality assessment tool that has been developed, and it's available. I'm sure if you search through the WHO headquarters website, you'll find the quality checklist. And in addition to that, I mean, for countries that use DHIS2, there's a data quality assessment tool that's built into DHIS2 standard package as well, which I would highly recommend for countries using DHIS2 to adopt. I mean, it's a very easy to use tool, and it has been proven to be effective in many settings as well. Thank you.
And also build on what Dilip mentioned, the data quality assessment checklist or assessment tool, we actually newly conducted in Vietnam at the end of last year, worked together with some partners. So because the tool is the standardized version or universal version, it's mainly cover the infectious disease control, some of the NCD. But based on the country, your own context, we are able to mobilize a little bit, especially for the area you are very, very keen to understand what's the quality issue, because it's also based on different scenarios in different health area. Over.
We have our next question from Dr. Mayang. What exactly are health data platforms, and is Mayo Clinic platform a data platform? Following that, what's the difference between data repositories and platform? What's the relation between the two, if any?
So it maybe I can answer first, but Dilip, feel free to correct me. Basically, it's really different in terms of using the language. And some countries, they use platform, some countries, they use portal, some countries use respiratory. So maybe it's better to first inform us the purpose of either the platform or what other terms you are using. Then we can give you a further explanation for the differences, if you don't mind. Over.
Yes, thank you, Dr. Duan. We also have another question. This is from Dr. Mel. Where can I get a training program about health information? Online training program?
For which specific health information? Do you mean like what we introduced today, or like any specific technical area? Over. Do you mind clarify your question? Online training on health information or data management?
Yes, data management, Dr. Duan.
Currently, from WPRO side, we are trying to develop the data management training plan based on country context, because different countries, they have very different needs, like the competency framework showed earlier. So if you can give us some of in-depth or detailed requests on which aspects of the health information or data management you are looking for, such as the systematic way to cover all the data person, or only focus on surveillance, or only focus on event-based surveillance, that will be maybe better for us to further share. But feel free to add more, Dilip or Dr. Kidong, if I miss anything. Over.
Certainly, this is a very broad question. I mean, different agencies offer different training packages for health information management, and certainly WHO too has a number of courses. Jai has very kindly put the link there. I've given another link as well. These are some of the links to some of the online training resources that WHO offers, which you might be inclined to check. Thank you.
We have another question in the chat box. It's from Sir Aret Ongkeko. Is there an assessment methodology that allows implementers to evaluate an individual's progress from a novice level to proficient level of competency?
Yes, because we have matched the question lists or interview lists to each of the professional level. So basically, based on the question, you are able to identify whether you are in novice level or master level. And also after potentially, as we mentioned earlier, it should link with the sustainable capacity building plan or training plan, at least in short term. So after the training and in certain time frequency, you can do you can reevaluate based on the pre-interview lists to further assess whether this person already reached to a higher level as required by your organization, or he's still stuck into the original level. Yes, it's possible. Over.
Thank you, Dr. Duan. Our next question is from Dr. Ian. Could the data be imported or exported to program in modano.com for strategic plan?
Do you mean the gap analyzing results? Or like which data?
The raw data as well can be extracted or imported, exported for strategic plan. So let's say, if previously I asked about the dashboard, right? From the dashboard that we imported, exported to modano.com for strategic plan. That's my question. Thank you.
So please correct me. For modano.com, this website, I'm not really sure. Because for at least for the country we are supporting, the data is owned by the government. Unless the government agree, we can further share the raw data. Otherwise, we cannot.
Okay. Thank you.
Thank you. We have another question. This is from Dr. Omi. Is there a specific tool to measure one of the implementation stages in the 7-step implementation, like a tool to assess all available and relevant resources for better mobilization?
So you may notice that the competency framework itself is capable to measure step 1 to 3. And for step 4 to 6, it's more like implementing. So our country office colleague in PNG, as well as Ministry of Health, actually would have much more to share. It's not a specific tool, such as in PNG, our country office colleagues already work together closely with the Ministry of Health to map all the existing resources. Basically, the first to do is to map the donor who are interested to fund on health information side. But meanwhile, potentially they will also map the internally from Ministry of Health level, what's the existing resource, both from the vertical program or technical program as well as the HR side. But it's still under discussion. Currently, maybe it's not so flexible to develop a standardized tool because the results in countries are quite different. And some country, like another country we're piloting, China, they don't really rely on too much donors. They would more prefer to use their internal resources. And even from province to province in China, some of the resources is not able to share among provinces. So hopefully that can answer your question. But of course, after more implementation in step 4 to 6 in PNG, we hope we can invite our country office colleague as well as Department of Health, Ministry of Health to share more. Over.
I would like to thank the WPRO team, Dr. Kidong Park and Mr. Dilip, and then Dr. Duan for sharing your time and taking your time and effort to be with us late in the evening. And then also, this is also a convenient time for most of our members to join after work. And this was very, very, very helpful to know. And then we look forward for more such knowledge sharing sessions in the future. Please do keep us updated on the further work. Look forward to see more experience coming in also from the countries and then the further work. And thank you very much for all our participants for joining us. Thank you.
Yes, thank you, everyone. Good night.
Good evening. Good night. Bye.
Thank you, everybody. Bye-bye.
Bye.
Thank you.